Today we'll be talking about Gerd. Let's begin by defining Gerd. Gerd means that over time, gastric contents from the stomach reflux into the lower esophagus. As a result of this constant reflux of acid, the mucosa of the lower esophagus becomes grossly damaged. The constant acid reflux into the lower esophagus will eventually cause the lining of the esophagus to change from squamous cell epithelium to columnar cell epithelium. This tissue replacement is known as intestinal metaplasia and leads to Barrett's esophagus, which is a precancerous condition. The etiology. There are several causes that would allow the lower esophageal sphincter to remain relaxed, hence lowering the distal esophageal pressure and subsequently facilitating reflux of gastric contents into the esophagus. These include foods, physical conditions, and the drugs. Let's talk about the types of food that can cause GERD. First, we have fatty food, then chocolate, alcohol, peppermint, and onions. Let's talk about some physical factors that can cause GERD. The following is a list of physical factors that can lower the distal esophageal pressure. We'll begin with pregnancy, then obesity, then coughing, fourthly, vomiting. Next, constant heavy lifting and straining, and lastly, constantly wearing tight-fitting clothes. There are also drugs that can cause GERD. These include nitrates, calcium channel blockers, caffeine, nicotine, theophylline, tricyclics, antihistamines, and anticholinergics. How would GERD present? So let's look on the presentation. First, these persons will come in with heartburn. Heartburn is a hallmark symptom. The burning usually occurs 30 to 60 minutes after meals. It worsens with lying supine, but improves by sitting upright. Patients may have chest pain due to esophagitis, while some patients may have hoarseness with persistent cough and wheezing. How's GERD diagnosed? If a person presents with heartburn and no other symptoms, a trial of PPI should be first given. If the patient improves, then the diagnosis of acid reflux may be established. If the patient presents with heartburn and failed the treatment with PPI, then a 24-hour pH monitoring should only be done because they have failed the treatment and the diagnosis is unclear. If the patient presents with heartburn and associated weight loss, anemia, blood in the stool, and dysphagia, then an upper endoscopy should be performed. The treatment. In mild to moderate GERD, lifestyle modification is the initial treatment. Start with raising the head of the bed at nights, or weight loss if the person is overweight, or no fatty meals or chocolate 3 hours before bedtime, and they also can stop smoking and most importantly, avoid alcohol. Let's talk about the medication treatment. If lifestyle modification doesn't work, then the patient should be started on PPI, which works in 90 to 95% of cases. PPI include omeprazole, or lansoprazole. The patient may also be started on H2 blockers, which include ranitidine, famotidine, and nazitidine. The patient may also be given Reglan, which is also known as metoclopramide, which helps clear the lower esophagus and improve the lower esophageal sphincter pressure. If medication treatment fails, and if lifestyle modification fails, then surgical treatment might be implemented. In cases where lifestyle modification and PPIs have failed, then surgery or endoscopic procedure to suture the lower esophageal sphincter tighter should be performed. The surgical procedure is known as Nissen fundoplication. Well, this brings us to the conclusion of this short presentation. I do hope that you have a better understanding of Gerd and will use this information to comfortably discuss the topic with your colleagues. Study hard, and I wish you well. Good night.